Our first guest today is Fiona Peacefull. She's the Executive VP Human Resources at Niagara Health. Fiona, 600 doctors approximately currently working for Niagara Health, but you're currently recruiting more to join the team.
Absolutely. So we are forever recruiting new staff and physicians to join the organization. We have about 7,300 members of our team, and that includes the physician group, includes our employees, our volunteers, and our patient partners. And it's actually about National Volunteer Week, so I'll do a special shout out to our wonderful volunteers.
Fiona, volunteers are important. We know that here at your TV as well. Looking at your background, there is a focus right now on diversity, equity, and inclusion, isn't there?
Absolutely. And if you think about the patients we serve, the most important thing that we want to do is really ensure that when people walk through our doors, they feel cared for people who can relate to them, understand their needs. And we have really sought to enhance the diversity of our workforce, create an environment where we're constantly learning about diversity, equity, and inclusion, and really identifying ways to make our workplace as inclusive and collaborative as possible.
And that's especially so as well when it gets up into the leadership ranks.
Absolutely. And one of the great things is, when we're conducting interviews, particularly for our leadership, and we're looking at members of our board, a couple of the key pieces we always look at is how are we diversifying representation? How are we diversifying the way we think, we make decisions, how we really support our Niagara community? And it's always critical in all of our discussions and our decisions for leadership positions and across the organization.
Looking at the need for physicians, do we have a lot of retirements coming up in the next few years as well?
Absolutely. And one of the things what we found is, and I use an expression that I can speak about, is called the gray tsunami, because I have gone gray, is that people are retiring. We have a workforce that's aging. We have individuals who are, transitioning to that next great step in their own retirement journey. And so we're seeing that across Canada. And so within our own workforce. So interestingly enough, our average age is 43. But then we have folks as young as 18 on our team, and then individuals into their 70s. So our average age is 43. But we do know, particularly with a number of our very experienced physicians and leaders and staff members, they are retiring. And so we're always looking to bring people in. I think COVID was also a real challenging experience, and now some people paused their retirement, and some people have escalated their retirement based on COVID. So we're seeing our vacancies are double to triple what they were pre-COVID.
In which departments do you have the biggest needs for new physicians?
So for physicians, it really is across the board. One of the areas recently we've seen, and this is a shortage across Canada, is for anesthetists. And that is a significant area of shortage across Canada. And of course, we're always looking for physicians to join all of our teams, just as we are with all of our staff. We are, but half the workforce is more of a nursing orientation and physicians. However, we're always looking for occupational therapists, physiotherapists, members of our environmental services team who do an amazing job at keeping our workplaces safe and clean. We are seeing, particularly some of the areas like the emergency department, seeing more of a draw for physicians and staff as well.
We look at Niagara's population, and it's expected to grow significantly, almost by 1/3, I would think, if not a little bit more. We've got the new Niagara South Hospital slated to open up in a few years. These are items that increase the need for doctors.
100%. 100%. And if you look at the demographics of our community, I think one thing we're really proud of is we have become a retirement destination. And when you look at the South Niagara, one of the things we're looking at is having a kind of a real focus on seniors wellness. So our South Niagara site, once it's opened, I mean, shovels will be in the ground this summer, but fast forward in 5 years, we will have particularly a community where we have some older individuals here. We know that there will be a need for that seniors care. One of the things we think is also really positive is a lot of times when someone finishes, whether it's medical school or nursing school or occupational therapy, physiotherapy, it can be really exciting to work in an environment where it's leading edge technology, leading edge equipment, design. And so we're hopeful that the new site will also be a great recruitment and retention tool for physicians and team members.
I know that McMaster medical students study at the Brock campus. Does that make it easier for you to attract new doctors?
I think on a really positive note is McMaster has a local campus connected at Brock. So that's been a fantastic way for us to partner with McMaster, is getting the students who attend that campus to come and work at Niagara Health. And we also get medical students from across the country. We are hopeful, though, that it will be even more attractive for students to come when they see the new South Niagara site and they see the kind of the diversity of programs. We also are looking to have an Indigenous healing garden and a space for our Indigenous patients. And hopefully when they see some of that innovation and real focus on patient care, they'll be interested in coming to Niagara Health.
From everything that I've read and seen about that new hospital, it does look like an almost, I don't know, a panacea, a wonderful place to work.
Yeah, it's pretty amazing when we saw the model, the replica, and when we also have had the partners we're working with, which is Ellis Don Healthcare, when they did it was a bird's eye view of as though you're almost flying through the building and around the building. And it does seem pretty remarkable. The one thing about a hospital, we'll see the building go up quickly, but it's the inside work that takes so much time. And just all the care and thoughtful decisions. I mean, I've been with the health system for coming up on 4 years. And one of the first meetings I went to was talking about getting ready for South Niagara. So there's been a lot of work put into it. And hopefully, we hope it will be a fantastic location for really extraordinary care for our community.
How are you reaching out to try to recruit these new doctors?
So we are forever, like daily, thinking about new ways, and ultimately one of the best ways you can really recruit physicians, and you can also recruit team members, is connecting with our academic partners. So as you mentioned earlier, partnering with McMaster and other medical schools and other other academic institutions with real focus on healthcare learning. And so we've been really working closely. The provincial government has done a number of incentive programs for physicians and for nurses in particular to look at how can we get those folks in the door, make sure that they're able to have a really positive experience as a medical learner, or as a soon to be recent grad, and how they transition to the workforce. So how do we make sure that when they get in the door, they have positive mentors, they have positive support, they're being exposed to the wide variety of patient journeys in our hospital. So they're getting some really rich, deep experience. And then also maximizing some of the ways to get internationally educated nurses, I think, and physicians. We've seen that there's many healthcare professionals who have, moved to Canada, and how can we support them joining our organization and really supporting a positive onboarding so that they can help us do our best work, and we're enabling them to really showcase their character and competencies at Niagara Health.
Fiona, it's been great speaking with you. Good luck on your recruitment process.
Thank you. And thank you so much for the opportunity to be here and showcase Niagara Health. And if anyone's interested in learning more, check out niagarahealth.on.ca, and our careers page has all the information on opportunities with us. Thank you.